So we often get asked a lot how we know how much skin to remove from the eyelids. Closed both eyes. And so what we want to do is take away all the excess skin, all the skin that's not necessary for safe eyelid closure. So to approximate that, in her case, about that much is what the excess is that's not needed for safe eyelid closure. So it's a good amount. Once we get her laying on her back and we inject numbing medicine, my judgment will be not as good. So what I want to do now is mark and measure everything first before we go back to the operating room. First thing we do, keep your chin up just a hair, is we're going to plan where the incision line will end. And I like to take the dominant crease of the eyelid. Once we have that baseline set, tip your chin down a little bit. Now I'm going to measure how much excess skin there is. And so with that, we could probably guess the rest of the lines. I like to measure it several times. And if anything, we're a little conservative on this, because if you take too much, they can't close their eye comfortably, and that would be a problem. A lot of people for the first few days after this don't close their eye perfectly comfortably, and that's just normal from swelling, but we don't want it on a long-term basis. She's got enough tissue here. We're going to do what's called an M-Plasty to keep it from bunching on the inner corner. Again, a little bit of advanced technique for taking out all the skin we need to without coming into this hollow spot where we don't want to make an incision. That's called an M-Plasty. I like this Sharpie marker because we can fine-tune lines and they don't blur. A traditional surgical marker would be super blurry at this stage. It would blur on the skin and then we wouldn't be able to do little critical erasures like that. One last double check. Make sure that I'm leaving a safe amount of skin for complete eyelid closure, which we are. So what I'm doing is measuring where the first supratarsal crease is, and I want to make sure that her other one ends up in exactly the same spot. Hers is already naturally there. Pinch technique, close both eyes, and this is just like taking in a dress. We're going to see how much excess fabric there is here. And it's different from side to side. We'll find we're going to take more on one side and less on the other, and that's why we measure that independently.